Hi, my name is Melissa, and I'm representing the Central Valley Latino Collaborative, a local nonprofit headquartered in Fresno, California. Our organization's mission is to improve the health and well-being of Latinos throughout Fresno County. Over half of Fresno County's population is comprised of Latinos whose primary language is Spanish. Many Latinos in Fresno County face many barriers when accessing healthcare services. Some of these barriers can include language, lack of transportation, or simply not knowing of services that are available to them at free or low cost. As a result, our organization would like to create an annual health fair in communities throughout Fresno County. This, in a sense, would be bringing the services to the people. People would no longer have to worry about going out to find out about information because we would have informational booths in which participants can seek information or find out about their eligibility statuses. Services we would like to highlight at this event is WIC, Medi-Cal, local low-cost clinics, as well as CalFresh benefits. Also, as part of the health fair, we would ask that mobile dental and immunization clinics also be a part of this event to provide the services to children. In organizing the effort, our organization's board of directors and administrative personnel convened in order to determine the logistics in which we can carry out this health fair. These logistics included various factors such as who we would partner with, where we would possibly be able to do it, and what would be the information we would like the community to gain. In convening the community and creating a shared vision, our organization identified several stakeholders. These stakeholders can include Fresno County Department of Public Health, Fresno County Department of Social Services, WIC, local health clinics, religious institutions, and well-respected individuals among the community. These stakeholders will serve as our committee members who will convene several times in order to determine a unified, shared vision of how we can better accurately facilitate this health fair and how we can recruit the biggest Latino population. It will be our ultimate shared vision that Latinos will no longer face barriers when accessing healthcare services, and that this health fair will, in a sense, decrease those barriers and lead to the better health status of Latinos throughout Fresno County. In assessing current realities and trends, our organization will focus on our target population, which is Latinos in Fresno County. We will identify secondary data from the CDC, Census Bureau, and Fresno County Department of Public Health in order to identify the disparities and barriers in which Latinos in Fresno County face. Our organization will also conduct one-time focus groups in various communities throughout Fresno County in order to get a feel of what community members feel are their actual barriers when accessing healthcare. We will also conduct asset mapping in communities throughout Fresno County just to determine the resources available to us, such as the place in which we can hold this event, who will help us, and what will be our barriers when trying to implement this health fair. In the action planning, our committee will convene in order to determine when we will have this event, where we will have it, who will participate, and what will be the logistics of it. Also, as part of the action plan, once the location is determined, the committee will convene in order to create a map, if you will say, of where vendors will set up their booths. Also, in determining where we will have the event, we will have to ensure that facilities are made available to meet any needs of the Latino population throughout Fresno County, and all vendors that participate must be bilingual. Our organization will face several steps in doing the job. Prior to the day of the event, all stakeholders and committee members will have to convene to ensure that everything is set in place and ready to go for the day of the event. The day of the event, we will have to ensure that all tables are labeled for each specific vendor, as well as ensure that there are 2 tables for every chair set up and that the mobile health clinics will have a place to park and are accessible to everybody. This health fair is first implemented in Parlier, California, and will later be conducted in Mendota, California. Our organization will monitor and adjust the health fair by surveying participants who attended the event. The way in which we will do this is provide a $100 incentive gift card for participants to complete the survey. The questions in the survey will ask participants, such as if they found out if they were eligible for any services, if they found out about any services they were unaware of, if the health fair made it easier for them to apply for or identify services, as well as if they feel the health fair should be implemented in their community once a year, or any comments or concerns they may have for us to better the event in the years to come.